If you or someone in your family has ever been treated for cancer, what I'm about to share matters more than almost anything else on this channel. According to research from KFF, roughly 100 million Americans currently carry some form of medical debt, and cancer patients are disproportionately represented in that number because cancer treatment doesn't happen once. It happens over months, sometimes years, with dozens of separate bills from dozens of separate providers. Hospitals, labs, anesthesiologists, imaging centers, each one billing separately, each one able to send your account to collections separately. What most patients never find out is that there is an entire industry built specifically around buying that debt for pennies on the dollar and then pursuing the full amount from people who are sick, exhausted, and in no position to fight back. Today, I'm going to walk you through exactly how that industry operates and, more importantly, what protections you already have, whether you know it or not. Before we get into it, subscribe to this channel and turn on the bell. The reason that matters here specifically is that medical debt rules have been changing fast. A major federal rule that would have removed most medical debt from credit reports was finalized in January 2025 and then struck down by a federal court in July 2025. Some states moved in to fill that gap with their own laws, others haven't. If you're not subscribed, you're relying on whatever you heard once, possibly years out of date. The people who follow this channel get the current picture. The ones who don't are often making decisions based on rules that no longer apply. Let's go through this one tactic at a time. Tactic number 1, hospitals selling your debt for a fraction of its value. Here's the part almost nobody understands about medical debt. When a hospital can't collect on an unpaid bill, it doesn't always chase you itself. In a huge number of cases, it sells the entire debt, sometimes thousands of accounts at once, to a debt buyer for a few cents on every dollar owed. Think of it like a store selling off old inventory in bulk to liquidate it fast, except the inventory is your unpaid bill. The hospital gets some quick cash and moves on. The debt buyer, who paid almost nothing for it, now owns the legal right to collect the full original amount from you and has every financial incentive to pursue it aggressively because anything they recover above what they paid is pure profit. If you've been contacted by a name you don't recognize about a medical bill, that is very likely what happened. Your action here is simple. Under the Fair Debt Collection Practices Act, any collector contacting you must send written validation of the debt within 5 days of first contact, and you have the right to formally dispute it in writing within 30 days. Until they validate it, they're required to stop collection activity. Don't pay anyone who calls you before you've seen that validation in writing. Tactic number 2, the financial assistance program most patients are never told exists. This is the one that genuinely upsets me to talk about. Under federal tax law, specifically Section 501 or of the IRS Code, every nonprofit hospital in the United States, and that's the vast majority of hospitals, is legally required to maintain a written financial assistance policy, sometimes called charity care, and to make reasonable efforts to determine whether a patient qualifies before sending their account to collections. In plain terms, the hospital is supposed to check if you qualify for free or reduced cost care before turning your bill over to a collector. In practice, this notification is often buried in paperwork handed to you during the most stressful days of your treatment, when reading fine print is the last thing on your mind. Income thresholds vary by hospital, but many nonprofit hospitals offer free care for patients earning up to 200% of the federal poverty level and discounted care well above that. If you were billed in full and never asked about financial assistance, call the hospital's billing office directly. Ask specifically for their financial assistance policy under IRS Section 501R and ask whether your account can be reevaluated, even retroactively. Some hospitals will adjust bills that have already gone to collections once this is raised formally. Tactic number 3, medical debt on your credit report and where that actually stands right now. In January 2025, the Consumer Financial Protection Bureau finalized a rule banning most medical debt from appearing on credit reports entirely. In July 2025, a federal court vacated that rule, ruling that the CFPB had exceeded its authority. As of right now, that federal rule is not in effect. Here's what is still true. The 3 major credit bureaus, Equifax, Experian, and TransUnion, voluntarily agreed back in 2022 and 2023 to remove paid medical collections from credit reports regardless of the amount and to exclude unpaid medical collections under $500 entirely. Those voluntary changes are still standing today. On top of that, roughly a dozen states, including California, New York, Colorado, and Illinois, among others, have passed their own laws restricting medical debt on credit reports, independent of what happens federally. Your action here: pull your credit reports for free at annualcreditreport.com. Look specifically for medical collection accounts and check whether your state has its own protection law. If a medical collection under $500 or a paid medical collection is still showing up, you can dispute it directly with the Bureau, citing the 2022 to 2023 voluntary policy. Tactic number 4, lawsuits and how far a debt collector can actually go. This is the part that frightens people the most, and the fear is usually based on what a collector implies rather than what the law actually allows. A debt collector cannot seize your home, garnish your wages, or freeze your bank account simply by deciding to. In nearly every state, they have to sue you in court first and win a judgment. Many medical debt lawsuits proceed by default simply because the person never showed up to respond, often because they assumed there was nothing they could do. If you receive a court summons related to a medical debt, that is not the moment to ignore it and hope it goes away. Responding, even just to dispute the amount or request proof of the original debt, dramatically changes the outcome. Many states also protect a portion of Social Security income and certain retirement accounts from garnishment entirely, even after a judgment. If you're on a fixed income and facing a medical debt lawsuit, contact your local legal aid office. Many offer free representation specifically for cases like this, and you can find yours through the Legal Services Corporation at lsc.gov. Tactic number 5, the harassment tactics that are technically illegal but happen anyway. The Fair Debt Collection Practices Act sets hard limits on how a collector can contact. They cannot call before 8 in the morning or after 9 at night. They cannot call you repeatedly with intent to annoy or harass. They cannot threaten action they don't actually intend to take, like claiming you'll be arrested over unpaid medical debt, which is not how the law works anywhere in this country. They cannot contact your employer about the debt except to confirm your employment. If any of this has happened to you, document the date, time, and what was said. You can file a complaint directly with the Consumer Financial Protection Bureau at consumerfinance.gov and with the Federal Trade Commission at reportfraud.ftc.gov. These complaints are taken seriously, and they build the case record against repeat offenders. One more resource worth knowing about: there is a nonprofit organization called RIP Medical Debt that uses donations to buy bundles of medical debt from collectors the same way debt buyers do, except instead of collecting on it, they forgive it entirely. They can't help with every case, and you can't apply individually for them to buy your specific debt, but it's worth knowing this kind of relief exists and occasionally reaches people through community partnerships and local campaigns. How many of you watching this have dealt with a medical bill from cancer treatment, either your own or a family member's? Tell me in the comments because it helps me know what to cover next. So here's where we land. If a debt buyer you don't recognize contacts you, demand written validation before paying anything. If you were treated at a nonprofit hospital, ask directly about their financial assistance policy under IRS Section 501, or even after the fact. Check your credit report for medical collections that should have been removed under the 2022 to 2023 Voluntary Bureau policy and find out if your state has its own protection law. Never ignore a court summons over medical debt, and know that Social Security income is protected from garnishment in most cases. And if a collector is harassing you outside legal hours or threatening things they can't legally do, document it and report it to the CFPB and FTC. This information exists because most people facing a cancer diagnosis are dealing with everything except the fine print of debt collection law. And that is exactly the gap this predatory side of the industry depends on. Subscribe and please share this with anyone you know going through cancer treatment or caring for someone who is. This is the kind of thing that helps most when it reaches someone before the collection calls start, not after.